Welcome to the deep dive. Today, we're tackling a subject many are curious about, but might find, a bit awkward to discuss openly: sex.
Hmm.
We've got excerpts here from the book Sex, an Uncensored Introduction, which, well, it pretty much aims to do exactly what the title suggests.
Right.
Our goal today is to pull out the most valuable and, honestly, the most interesting insights from this really comprehensive guide. It covers everything from sexual health to relationships.
Yeah.
Think of this as your, express route to getting seriously well-informed on a topic that, let's face it, touches all our lives in some way.
Absolutely. And what jumped out at me immediately about this book is its refreshingly candid tone. It's even humorous, which you see right from the acknowledgement.
Oh, yeah.
Yeah, the author mentions getting support from sexual education experts, which is great, but then playfully hints at the book's style by mentioning email subject lines like penis queries.
Huh. Imagine getting that.
Exactly. Or condoms in butts. It signals right away. This isn't going to be some dry clinical textbook.
Definitely not. And the introduction really leans into that. The author talks about this idea, which seems simple but is actually quite powerful, of combining sex and books into this one magnificent object. It's like they're saying, look, this is a fundamental part of life, so let's, bring it out into the open and talk about it, just like we discuss any other important subject.
Precisely. It sets the stage for an open discussion.
Okay, so let's dive into our first area: vaginal discharge.
Right. This is a topic that can cause a lot of unnecessary worry. So the book kicks off by just reassuring readers that vaginal discharge is usually completely normal.
Okay, that's good to hear.
And what's really key to understand is its function. It actually plays a vital role in keeping the vagina clean and helps prevent infections.
So it's not a sign something's wrong, it's the opposite.
Often, yes. It's a natural process doing its job.
And it's not always the same, is it? The book points out that the color, texture, and amount, well, they change throughout the month.
Exactly. It mentions it can be clear, white, or maybe slightly off-white, and the texture can range too, sometimes thin and sticky, other times thicker, more gooey.
So those variations are just normal fluctuations.
They are. But, and this is really important, the book stresses that certain changes do need immediate medical attention.
Okay, like what specifically?
We're talking changes in odor, particularly a strong or fishy smell, or a significant shift in color, like greenish or grayish.
Got it.
And also any kind of itching, burning, swelling, or bleeding that happens when you're not having your period. Those are definite red flags.
So the advice is clear: see a doctor.
See the doctor or go to a clinic right away if you notice any of those things.
That's crucial information. Okay, moving on to another bodily function that can sometimes cause confusion, especially for guys. Spontaneous erections and morning wood.
Yeah, the book really normalizes this. It explains that those random erections, even if they happen at, the most awkward times, the book even jokes about math class.
Right.
They're simply a result of hormonal changes during adolescence.
So nothing to worry about.
Exactly. And waking up with an erection or nocturnal emissions that's ejaculating during sleep are also presented as perfectly normal, typical things. It's just the body doing its thing.
It's always good to have that reassurance, especially when your body starts telling things you don't fully understand yet. Now, the book also offers a quick explanation for anyone who might be fuzzy on how babies are actually made.
It does. It really just boils it down to the basics, providing a very straightforward answer. Useful if maybe you picked up some less than accurate info elsewhere.
A quick, no-nonsense summary.
Pretty much.
And sticking with understanding body changes, the book addresses anxieties about developing sexual characteristics during puberty.
Yeah, this is a big one. The text offers really helpful reassurance here. It says the vast majority of variations in size and appearance as you go through puberty are completely normal.
So there's a wide range of
A
norms.
very wide range. It's important not to compare yourself to, potentially unrealistic ideals you might see.
Good point. Now, this next section definitely brings in some of that humor we mentioned. The book lists some very creative and informal names for body parts.
Oh, this is where it gets interesting. And definitely good for a chuckle. It lists all sorts of colorful slang. For breasts, you've got terms like airbags or even titty bojangles.
Titty bojangles. Seriously.
Seriously. For the penis, things like the one-eyed trouser snake or the purple-headed yogurt slinger.
Wow, okay.
Scrotum gets names like bagpipes or hangy-down bits. And for the vagina, well, there's kitty, honeypot, and even the slightly odd bald man in a boat.
Bald man and boa. I don't even know what to picture there.
Right. But it shows the huge range of language we use, from the clinical terms to the very informal. It highlights different comfort levels and cultural attitudes. Sometimes these names can make it easier to talk, especially for younger people, but sometimes they can just obscure clear communication.
It definitely highlights the spectrum. Okay, next up, body odor during maturation. A pretty universal experience, I think.
Absolutely universal. The book explains that those new, sometimes surprising body odors popping up during puberty are totally normal, all thanks to hormones shifting.
And it points out specific areas.
Yeah, underarms, the penis and scrotum area, and the vagina are where you might notice changes in scent.
And it gives advice on managing them.
It does. For underarms, pretty standard. Deodorant or antiperspirant. It makes a useful distinction too. Deodorant masks odor, antiperspirant reduces sweat.
Okay.
For the penis and scrotum, it's mainly about good hygiene, washing gently with mild soap, being careful around the urethra, maybe using some unscented powder to help with moisture.
And what about the vagina? There's a lot of marketing around products for that area.
Yeah, and the book makes a really important point here, is a mature vagina naturally has its own distinctive smell. It's not necessarily bad, just characteristic.
So no special washes needed.
Exactly. The best approach is simply cleanliness through regular washing. Those special scented products can actually do more harm than good, disrupting the natural balance.
That's a good, reassuring message. Okay, another physical change. Hair growth. And the book mentions hair removal.
It does. It lists the common methods: waxing, shaving, depilatories, plucking, laser removal.
But the key point isn't the method, is it?
No, the crucial takeaway is about personal choice. The book really stresses that if you decide to remove hair, it should be because you want to, not because of pressure from others or some idea of how you're supposed to look.
Totally agree. It's about your comfort and your choice. Okay, let's move into a topic that affects, well, about half the population directly: menstruation.
Right. The book gives a clear, straightforward explanation. It describes menstruation, or a period, as the natural shedding of the uterine lining.
Which builds up each month.
Exactly. The lining thickens to prepare for a possible pregnancy. If that doesn't happen, the lining is shed.
And the fluid itself, it's not just blood, right?
Correct. It's mainly blood, but also contains tissue and mucus from that uterine lining. The appearance can vary quite a bit too.
How so?
Color might be bright red, dark red, even brownish. Sometimes you might see small clots. That's all normal. The book also mentions a typical length, usually 3 to 6 days.
And the not-so-fun side effects.
Oh, yes. Cramps, back pain, breast tenderness or puffiness, bloating, feeling cranky, maybe acne flare-ups. Many people will recognize that list.
Definitely. The book also talks about irregular periods, which can be worrying, especially when you first start.
Yeah, especially in those first few years, periods can be really unpredictable. The book reassures that this is very common, and it usually settles into a more regular pattern.
But not always.
Not always. Some people naturally have more irregular cycles. The main advice here is, if you're significantly concerned about irregularity, talk to a doctor.
Always best to check. And for managing periods, the book covers pads and tampons.
Yep. Explains pads are external, good if you're not comfortable with insertion. Tampons offer more freedom for activities like swimming or sports.
And hygiene is key, right? Changing them regularly.
Absolutely critical. Change pads roughly every 3 to 4 hours, tampons every 4 to 8 hours. This reduces health risks. And a huge point, never ever flush them.
Right, wrap them up and put them in the bin.
Exactly. Wrap in toilet paper, dispose of in the garbage.
Good practical advice. What about bleeding between periods?
The book calls this spotting. It advises that if it happens without heavy bleeding or pain, it might not be an immediate emergency.
But still worth checking out.
Definitely. You should still schedule a doctor's visit to rule out any potential underlying issues. Spotting can sometimes be a symptom of something needing medical attention.
Better safe than sorry. The book also seems to try and reframe how we think about periods generally.
It really does. It encourages viewing a period not as something embarrassing, but as a positive sign, a sign of health, that you're not pregnant, and completely normal bodily function.
Yeah.
And it even has a message for boys, urging empathy. Like, keep negative thoughts to yourself, just as you wouldn't want girls making fun of your normal body stuff, like random erections. It's a call for mutual respect.
A really important message. Okay, let's pivot to doctor's visits. The book talks about routine checkups.
Yeah, it makes the point that while those checkups might seem less fun as we get older, maybe the lollipops aren't as exciting.
True.
The health benefits are definitely worth any minor awkwardness. They're vital for staying healthy and catching things early.
And for girls, specific reproductive health exams become important too.
Right. The book mentions girls usually start these visits sometime after puberty, maybe ages 14 to 17.
And what do those involve?
They can include breast and pelvic exams, plus important chats about birth control options, STI prevention, things like that. It really highlights how important these visits are, especially if you're sexually active or have concerns about your period.
And can you see your regular doctor for this?
Often, yes. You can discuss these things with your family doctor, or you might choose to see a gynecologist who specializes in this area.
Now, the pelvic exam itself, that can cause some anxiety. The book describes the process.
Yes, quite clearly, which can definitely help ease nerves. You lie on an exam table, usually in a gown, feet in stirrups. The doctor first looks at the external area, the vulva and vaginal opening.
Okay.
Then, a speculum that's the instrument, metal or plastic, kind of duckbill shaped, is gently inserted. It just opens the vaginal canal slightly so the doctor can see inside, including the cervix.
And sometimes a pap smear is done then too.
Exactly. The book explains a pap smear involves collecting a small cell sample from the cervix with a little spatula and brush.
And that's sent to a lab.
Yep. Sent to a lab to check for any precancerous cell changes. The book notes this is very unlikely at a young age, but it's a key preventative measure as you get older.
Makes sense.
And if you're sexually active, the doctor might also take swabs then to test for STIs.
Knowing what to expect definitely helps.
Hmm.
Okay, shifting topics slightly to body image and potential medical procedures. Breast augmentation and reduction.
The book presents breast reduction surgery as a real option for those with large or uneven breasts causing physical discomfort like back pain or maybe unwanted attention. It says these procedures are generally safe and standard.
And augmentation. Getting implants.
Here, the book advises more caution, especially for teens. It stresses potential risks and strongly recommends waiting until breasts are fully developed. And, ideally, getting a recommendation from a physician, not just a plastic surgeon.
Right, not rushing into things based on temporary feelings or pressure. Related to body image, the book also covers eating disorders.
It stresses how critical it is to seek professional help quickly if you suspect you or someone you know has an eating disorder.
And recovery is possible.
Absolutely possible, it emphasizes, with the right support and treatment. And for friends worried about someone, the best thing is just to be there. Encourage them to get help from doctors or therapists and support their recovery, not the disorder itself.
That's important advice for friends. And on a similar note, it warns against unsafe weight loss methods.
Specifically calls out using laxatives and diet pills, explaining they're unhealthy and potentially dangerous. Also points out the negative effects of crash dieting on metabolism.
And acknowledges the pressure to be thin.
Yes, it acknowledges that intense societal pressure for unrealistic thinness and strongly advises talking to a doctor for healthy, safe weight management advice if needed.
Prioritizing health over unrealistic ideals. Okay, let's shift gears again to talk about identity and experience, specifically transgender experiences.
The book acknowledges the really significant and complex challenges transgender individuals face, both the internal struggle with gender identity and external societal pressures, discrimination.
He uses an analogy.
A powerful one, like being in the closet, but it's filled with someone else's clothes that don't fit. It vividly describes the deep discomfort of not living authentically.
That's quite an image.
And it strongly highlights how crucial support from friends and family is in encouraging trans individuals to live as their identified gender. It's vital for their well-being.
And for those considering medical transition, the book gives some basic info.
Yes, for a female-to-male transition, it mentions hormone therapy leading to clitoral enlargement and the possibility of surgery to create a penis using clitoral tissue, noting the surgery techniques are always improving.
And male to female.
Hormone therapy for breast development, maybe implants later, and surgery to create a vagina using penile skin. It's a concise overview of some key medical aspects.
Good foundational info. Now, for anyone maybe questioning their own sexual orientation or gender identity, the book has some reassuring words.
Very reassuring. It encourages patience and self-acceptance above all, emphasizes there's no pressure, no timeline for figuring these deeply personal things out. It validates feelings of confusion or uncertainty.
It's okay to take your time.
Absolutely.
And it specifically mentions bisexuality, too.
It does. Presents it as a valid orientation, maybe explaining shifts in attraction over time, or attraction to more than one gender. It underscores the importance of acceptance and understanding, both for yourself and others. It uses an example of maybe a parent dating both men and women to illustrate.
That message of inclusion is so important. Okay, let's move into social interactions. The book has some maybe surprising advice on dealing with rudeness.
Yeah, it's a bit counterintuitive.
Mm.
It suggests trying to respond to rudeness with kindness.
Really? Why?
It proposes it as a way to maybe disrupt the dynamic, possibly influence the other person's behavior, almost like a short-term experiment. Even if it doesn't change them, it might help you see their rudeness as their issue, not aimed personally at you.
Interesting take. What about a more personal, often emotional situation? Coming out as gay to your family.
The book acknowledges parents can react in many different ways. Recognizing it can be overwhelming for everyone, it suggests a gradual approach.
Instead of telling everyone at once?
Right. Maybe tell one person at a time. It could feel less confrontational, allow for more individual conversations and processing time.
That sounds like a potentially gentler strategy. Okay, back to the physical side. Masturbation as preparation for partnered sex.
The book frames masturbation as a really valuable way to learn about your own body, what feels good, what you like.
And that self-knowledge helps with partners.
Essential for good communication later. You can't really tell someone what you enjoy if you don't know yourself, right?
Makes total sense. The book also touches on how views on masturbation have changed historically.
Yeah, it mentions those really outdated, bizarre medical views from the 1800s into the early 1900s, calling it self-pollution, thinking it was unhealthy.
Wow.
Then contrast that with the medical community finally agreeing in the 1960s that it's natural and healthy. Though, as the book points out, some negative stigma unfortunately still lingers.
Fascinating how understanding evolves. Let's get specific about female masturbation.
The book explains the clitoris fills with blood during arousal, much like a penis. It gives practical tips on finding and stimulating it, suggesting experimenting with different pressures and speeds.
Lubrication, toys.
Mentions using lubrication can enhance pleasure, and yes, even sex toys like dildos or vibrators or just water pressure in the shower. It also describes orgasm, those involuntary pleasurable muscle spasms in the sexual organs.
And exploring variations in masturbation.
It suggests things like trying anal play, different positions or locations, privately of course, using fantasies, experimenting with textures like condoms or lube.
But with a warning.
A very important one. Don't do anything that could cause harm or insert objects where they don't belong. Safety and common sense are key.
Always. And orgasms might feel different over time.
Yeah, it mentions sensations can change throughout life, reassuring readers that fluctuations in self-pleasure are normal. Doesn't mean something's wrong.
Good to know. What about masturbating with a partner? Mutual masturbation.
Oh yeah. It describes that masturbating in front of each other, maybe touching yourselves, maybe each other, as a common and very safe way for couples to explore preferences and learn what the other person likes.
Takes out the guesswork.
Exactly. And, as the book jokes, it's about as safe as sex gets regarding STIs.
Definitely a way to build intimacy. Okay, let's shift to the fundamental decision. Whether or not to have sex at all.
The book makes a really crucial point here. The decision should be based entirely on your own personal desire and readiness.
Not pressure or other motives.
Absolutely not. Not based on pressure, not as a reward or punishment, not for revenge. Choosing to remain a virgin is presented as a totally valid, empowering decision that deserves respect.
So important to stress personal agency. And if someone does decide to be sexually active, communication is key.
Paramount. The book underscores open, honest communication with partners, feeling comfortable talking about needs and desires, and being able to confidently say when something feels uncomfortable or wrong.
And the principle of consent.
Strongly emphasized, no means no at any point. Being able to say no before or during any sexual encounter is fundamental.
Essential lessons. Now, a complex legal area. Age of consent laws.
The book explains these laws are complex and vary significantly state by state. They cover the legal age for sex and acceptable age differences.
And different rules for different acts sometimes.
Sometimes, yes, or if parental consent is involved. The crucial takeaway is, even if you feel ready, if the activity violates the law in your state, there could be serious legal consequences, like prison or juvenile hall.
So you need to know your state's specific laws.
Absolutely. The book strongly advises checking reliable, up-to-date sources, like official government websites, not just relying on friends or forums. These laws really show society grappling with balancing protection and autonomy, so safety and legality must come first.
Critical information. The book also mentions some older, possibly outdated laws still around.
Yes, mentions some states might still have old laws about oral or anal sex. It also notes the work of groups like the ACLU and LGBT rights organizations trying to update or repeal these, a reminder that laws don't always keep up with society.
Good point. Okay, back to the physical experience. Orgasm.
The book just reiterates what happens. Stimulation leads to those involuntary rhythmic muscle contractions in the sexual organs, plus the pleasure and release of endorphins in the brain.
And checking in with your partner during sex.
Continuous communication is vital, making sure it's enjoyable for both, no pain, no discomfort. The advice is simple. If something hurts or feels wrong, stop. Try something else. Sex should feel good for everyone.
Now, myths. The book tackles the one about vaginal looseness.
Directly debunks it. This persistent myth that sex makes the vagina permanently loose or stretched. Not true.
How does it explain it then?
Explains the vagina is naturally a closed muscular canal that expands remarkably to accommodate things like a penis or a baby during childbirth and then returns to its resting state. It's elastic, pliable, it doesn't stay stretched from sex.
Important myth to bust. What if someone's first sexual experience is negative?
The book acknowledges that happens, unfortunately, and it can lead to negative feelings about yourself or sex. It encourages using even difficult experiences as learning opportunities for future choices and boundaries.
Learning from everything. And the myth about physical signs of virginity.
Calls it a complete myth.
Yeah.
Unequivocally, there's absolutely no physical way to tell if someone has had intercourse just by looking at them. Body changes or puberty, regardless of sexual activity.
It's so impossible to tell. Now, the book raises an interesting point about defining virginity, especially regarding anal sex.
Yeah, it poses the scenario. Someone promised to stay a virgin until marriage, but considers anal sex. Does that count? The book highlights the ambiguity, the lack of a universal definition of virginity. Makes you think what that word really means to different people.
It really is personal interpretation. Let's talk about foreplay.
The book defines it broadly. Any sexual activity before oral, vaginal, or anal sex meant to arouse and build intimacy, kissing, touching, exploring genitals, but not like taking off shoes.
Right. And it serves a physical purpose, too.
Definitely. Prepares the body. Increases blood flow to the genitals, causing erection in males, clitoral engorgement, and vaginal lubrication in females. Makes intercourse more comfortable, more pleasurable.
Even kissing has nuances, right? The book talks techniques.
Emphasizes everyone has different preferences. Best advice. Be patient. Pay attention to your partner's reactions. Maybe start gentle, closed mouth. Gradually introduce tongue rather than jumping straight into tonsil tennis.
Good advice. Pay attention. Find what works for both. Okay, pre-ejaculatory fluid or pre-cum?
The book describes it as fluid released by some males between arousal and ejaculation. Its job is to lubricate the urethra and help sperm passage.
And the amount varies?
Yeah, varies a lot. Producing a lot or a little, both are normal. Importantly, the book highlights pre-cum can contain sperm left over from previous activity or masturbation.
So pregnancy is possible from pre-cum?
Definitely possible. A key point for contraception awareness.
Absolutely. Now, anal play. Sometimes less discussed.
The book explains it involves the anus and butt area in foreplay or sex. It can range from external touching to inserting fingers or toys.
Mentions the prostate for men.
Yes. Located internally, stimulation can be intensely pleasurable, even lead to orgasm, though maybe not first date talk. Also notes some girls enjoy anal touching or fingering too. It's all individual preference.
And lubrication is essential.
Absolutely crucial. The anus doesn't self-lubricate like the vagina, so lots of water-based lube is needed to prevent discomfort or injury. And always wash hands thoroughly after anal play before touching genitals or mouth to avoid spreading bacteria.
Important safety points. The book also talks about erogenous zones beyond the genitals.
Yeah, areas sensitive to touch that cause arousal. Gives examples: nipples, neck, feet, lower back, earlobes, even inside the ear canal for some.
So explore.
Exactly. Slow, gentle exploration, paying attention to partners' reactions. Don't assume based on past partners. Everyone's different.
Pleasure is diverse, and intimacy isn't just physical.
Right. Book gives nice examples of non-physical intimacy. Cooking dinner for your partner, preparing a picnic. Acts of care and attention build closeness.
Lovely. Okay, common scenario. Makeout sessions getting more intense, uncertainty about going further.
The advice is practical. Set boundaries and discuss readiness and safety before things get superheated. Better to talk calmly, not in the heat of the moment at, as the book jokes, third base.
Proactive communication helps avoid awkwardness. What about when one partner wants more physical intimacy than the other?
Suggest talking about it when things are relaxed, not sexually charged. Acknowledges it can feel nerve-wracking to bring up wanting more.
Uses an analogy.
Yeah, it says boys' excitement can sometimes be like the Incredible Hulk. Desire escalates fast, making it hard to slow down. Key is sensitivity and understanding in the conversation.
Open, honest communication again. Okay. Defining the main types of sex. Oral, vaginal, anal.
Presents these as the primary three discussed, while acknowledging other possibilities exist. Emphasizes knowing what you're doing for safety and pleasure in any sexual activity.
And it specifically covers lesbian sexual practices.
Yes. Mentions oral sex and manual stimulation are common, often considered full-on sex, not just foreplay like sometimes perceived in straight contexts.
Describes scissoring, too.
Describes scissoring lying with legs interlocked, vulvas rubbing. Notes it's intimate, but carries STI risk due to direct genital contact, advising it mainly for long-term, tested, committed relationships.
Good specific info. It also debunks a myth about lesbian sex skills.
Yeah, the stereotype that women inherently know how to please other women just because they have the same parts compares it to outdated stereotypes about women's domestic skills.
The trial and error needed there, too.
Absolutely. Highlights individual differences, need for communication and exploration in lesbian relationships, just like any other.
Reinforces that communication is universal. Now, a more advanced act, fisting,
Defines it as inserting a whole hand into the vagina or anus, usually finger straight. Strongly emphasizes needing extensive lubrication, rubber gloves for safety, and very gradual insertion, starting maybe with one finger, always with explicit ongoing consent.
and it's high risk.
Definitely states it's not for everyone. Potential for discomfort carries risks of bleeding, tissue damage, STI transmission. Needs extreme gentleness, trust, and excellent communication.
Sounds like it requires extreme care. Okay, safe anal sex practices again.
Reiterates the need for lots of water-based lube because the anus doesn't self-lubricate. Condoms strongly recommended for STI prevention.
And avoid oil-based lubes with latex. Good distinction. And it gives guidance on giving oral sex to a woman.
Gently discourages the term eating out. Emphasizes sensitivity. Suggests starting with kissing areas between waist and thighs. Guides on locating labia and clitoris under the hood.
And the technique.
Advises gentle tongue exploration, paying close attention to partners' reactions, starting slow and sensual. Recommends looking up to check enjoyment, asking for feedback, maybe non-verbally if mouth is busy.
Consider it a tuned approach. Okay, let's shift focus fully to STIs. How are they spread?
Explains two main ways. Direct skin-to-skin contact with an infected area, and exchange of bodily fluids during oral, vaginal, or anal sex, including between genitals and mouth. Notes STIs range from minor curable to severe treatable.
A wide spectrum, so prevention is key. Condoms and dental dams.
Condoms highlighted as best protection besides abstinence. Stress proper, consistent use for all types of sex. Introduces dental dams, thin latex or polyurethane sheets for covering the vagina vulva during oral sex.
And condom materials. Latex is common, but some are allergic.
Right. Latex is most common. Durable. Effective. Polyurethane, plastic, is an alternative for allergies, thinner feel, maybe better sensitivity but less flexible, more prone to break without enough lube, often pricier.
What about sheepskin condoms?
Mentions they prevent pregnancy, but not STIs. Pores are too large. Viruses can pass through. Made from sheep intestine lining, actually.
Good to know they don't protect against STIs. Lubricated condoms are generally better.
Generally recommended.
Yeah.
AIDS insertion, reduces tear risk, stresses makes you use water-based lube with latex condoms. Oil damages them. Mentions adding a drop of water-based lube inside the condom tip is a personal preference some have.
What about changing condoms during sex?
Advises having extras and changing if erection is lost for a while or if sex lasts a long time. Prevents shifting or drying out, which increases breakage risk.
Improper removal.
Remove while still erect. Hold the tip base to trap fluid. Slide off carefully by the ring at the base.
Disposal. Wrap and bin, not flush.
Exactly. Wrap in toilet paper, put in trash. Never flush, bad for plumbing, environment, and definitely never reuse condoms.
What if one breaks or slips off?
Stop sex immediately. Check for and remove any broken pieces. Consider using emergency contraception if pregnancy is a concern.
And if you suspect you have an STI, get tested.
Immediate advice. See a doctor or go to a clinic for testing. Don't try to self-diagnose online. Healthcare providers use blood tests, urine tests, swabs from cervix, vagina, or skin around genitals, but
Professional diagnosis is crucial. The book mentions the Comstock Law briefly.
yes, that 1873 U.S. law making it illegal to mail contraception or pornographic materials led to mail inspection prosecutions. a stark example of past restrictive laws. Notes the Supreme Court overturned it in 1983.
Shows how much things have changed legally. What about telling a partner you have an STI?
Stresses this is an ethical responsibility. Inform partners before any sexual activity. Explain the need for condoms. Provide info about the STI, prevention, treatment. Respect their decision based on that info. Says personal integrity is more defining than having an STI.
A really important message about respect and responsibility. It also addresses shame or guilt.
Reassures that having an STI doesn't define you, and they're relatively common. Encourages avoiding self-blame, seeking support, especially for HIV. Advises consistent condom use moving forward.
Moving forward responsibly. And it clarifies that not every genital symptom is an STI.
Right. Lists harmless things that can mimic STIs. Ingrown hairs, yeast infections, UTIs, bacterial vaginosis, inflamed glands, even zits. Emphasizes seeing a doctor for diagnosis, not relying on the internet.
Especially yeast infections, which it details a bit.
Describes them. Vaginal irritation, often itching, chunky white discharge like cottage cheese, maybe a smell like unbaked bread, sometimes redness, pain, not usually STIs linked to stress, diet, tight clothes, etc. Some docs think they can pass to partners, so maybe abstain during infection. Guys can get them too. OTC treatments exist, but see a doctor for persistent recurring ones.
Again, doctor for diagnosis. It also warns against Googling symptoms and assuming the worst.
Yeah, uses the example of seeing symptoms and jumping to penile cancer online. Clear advice. See a real doctor for accurate diagnosis and treatment for any concerning symptoms, like burning during urination. Suggest confidential clinics if talking to parents is hard.
Definitely avoid the Dr. Google panic spiral. Okay, shifting to birth control effectiveness.
Gives typical percentages. Male condoms around 82% effective with typical use. The pill, about 92%. The shot, Depo-Provera, higher at 97%.
Mentions less common barrier methods, too.
Female condoms and diaphragms. Notes they're less popular than male condoms, maybe due to insertion challenges right before sex. Diaphragms also need custom fitting by a doctor. Also clarifies, don't use male and female condoms together. Friction causes breakage.
Condoms are easy to get, though.
Points out they're available at drugstores. Usually no age restriction to buy.
What about the hormonal methods, like the shot and IUD?
Describes the shot, Depo-Provera, as a hormone injection given by a doctor every 3 months, arm or butt. The hormonal IUD is a small T-shaped plastic device inserted into the uterus by a doctor, releases hormones, effective for as long as it's in place.
But hormonal methods can have side effects.
Lists potential ones for methods like the pill, weight gain, bootiness, skin changes, hair growth in new places, changes to periods, highlights increased blood clot risk for smokers on the pill, mentions rare but serious risks like stroke, heart attack, underscores need to consult a doctor before starting any hormonal birth control.
But also positive side effects sometimes.
Yes, can include shorter, lighter, less painful periods, even better acne for some. Again, needs discussion with a doctor for personalized advice.
Weighing pros and cons with a doctor is key. The book also briefly outlines the abortion procedure.
Describes a medical abortion. Pain sedation meds, speculum, maybe cervical dilation, meds or instruments. Then a tube uses gentle suction to remove fertilized egg pregnancy tissue. Sometimes another instrument used to ensure removal, short recovery, antibiotics typical.
And touches on the legal and ethical side.
Mentions legal status in the U.S. in '73, ongoing opposition, potential clinic protests. Emphasizes it's the individual's body and decision, free from coercion. Notes state laws on teen parental consent vary. Advises calling Planned Parenthood for info on rights options.
Navigating that can be tricky. What if parents disapprove of a teen using birth control?
Points out parental permission usually isn't needed legally in most U.S. states for minors to get contraception. Advises trying open communication with parents, understanding their concerns, remembering living at home isn't forever. Suggests confidential services like Planned Parenthood if the family-doctor relationship isn't comfortable for BC prescriptions.
Communication and knowing your rights. It briefly mentions a boyfriend claiming to be clean.
Doesn't state a direct response, but strongly implies caution. Relying just on someone's word instead of condoms for STI prevention is risky. Underscores safer sex regardless of claims, as only testing confirms status.
Taking responsibility for your own health. Okay, let's dive into relationships themselves, different types.
Defines several. Dating, casual, going out exclusive, hooking up, physical only. Friends with benefits, regular physical intimacy, no relationship. Stresses importance of mutual understanding about what the relationship is.
Clarity prevents hurt feelings. What about online dating?
Acknowledges potential to find compatible people, but highlights risks, uncertainty if someone's truthful. Advises precautions. Take time getting to know them online, phone video calls, meet first time in a safe public place. Maybe bring a friend.
And essential safety tips. Commitment in a relationship.
Defined as faithful, exclusive, a big step, but offers dependability support. Importantly, commitment doesn't require sex. Healthy relationships without immediate sex are possible, but sex within a trusting, committed relationship often leads to better experiences.
What if you're committed but attracted to others?
Suggest this might signal unhappiness or unmet needs in the current relationship. Advice is open, honest talk with your partner is questioning commitment. Stress is lying is the worst thing for a relationship.
Honesty, even when hard. How does sex usually affect a relationship dynamic?
Often intensifies it, makes it feel more serious. Can be positive or cause discomfort if the pace feels too fast. Communication about feelings is crucial. Awkwardness after sex, even with prior intense feelings, is normal, need mature communication. If sex overshadows friendship, consciously make time for non-sexual activities for longevity.
Finding that balance. Of course, relationships end. Breaking up.
Acknowledges the emotional impact, unique for everyone. If you're dumped. Common to question self-worth, feel anger, lingering love. If it's after a first sexual experience, can feel extra hurtful. Remember, the initial decision was personal. Maintain self-worth.
And if you're the one ending it?
Emphasizes respecting their feelings. Break up in person if possible, not text or mail phone. Don't involve friends in the actual conversation. Calmly explain reasons as gently as possible. Avoid contact afterward, even if you feel bad they're not your support system then.
Respectful advice. What about right after a breakup?
Because is missing them, potential temptation of breakup sex. While tempting due to loneliness, generally discouraged as it often complicates emotions and moving on.
Can definitely prolong the pain. A very serious topic now. Abusive relationships.
Defines abuse clearly. Put-downs, yelling, insults, coercion, threats, isolation, physical violence, all tactics for power and control. Notes, it can be hard to recognize. Abusers often justify behavior, blame victim. Paramount advice, get out, safely, quickly. Listen to your gut. Seek support from trusted people or resources.
Absolutely critical. What about obsessive controlling behavior that isn't physical?
Stresses, this is also very serious. Even if you care for them, set firm boundaries. You're not responsible for their threats of self-harm or manipulation. Highlights harmful obsessive actions. Reading emails, texts without permission, extreme jealousy, even amidst good times. Red flags not to ignore.
Important warning signs. Okay, let's explore kinks, fetishes, fantasies.
Breaks them down nicely. Kink, an activity you're interested in trying or likely to try with a comfortable partner. For example, spanking, tying up, role-play costumes, pinching.
Okay, and fetish.
An object, clothing item, or body part causing arousal. Example, high heels, leather, maybe noses or specific scenarios.
And sexual fantasy.
A situation you like to think about or play out during sex. Example, dominant submission, stranger sex, authority figures, public sex, even pretending to be animals. Notes difference between fantasies may be enacted, if safe, legal, consensual, and those purely for imagination.
Helpful categories. What if you worry about a partner's fantasies?
Reassures it's unlikely they're based on real-life obsessions wanting harmful action. Often stem from general arousal triggers, exploring sexuality mentally. Advises open communication about fantasies, maybe exploring each other's interest, fosters intimacy, avoids paranoia.
Communication again. What if a partner wants dominance but seems hesitant?
Suggests if they're hesitant, maybe raised to be respectful, fear overstepping, acknowledging that and gradually exploring the dynamic might help. Just telling them what to do might kill the excitement. Find a way that feels good for both.
Finding that shared comfort zone seems communication is the thread through everything.
Absolutely. Open discussion of feelings, desires, boundaries, repeatedly emphasized as crucial for healthy, fulfilling sexual experiences.
And honesty about relationship intentions from the start.
Yes. Be upfront. Looking for commitment, or just a hookup. Avoids misunderstandings, hurt feelings. Similarly, if stronger feelings develop in a casual setup, express them, even if scary. The other person needs to know.
Honesty even when vulnerable. The book includes resources for more help.
Yes, notes a dedicated resources section, helpful books, numbers, websites for more info or support.
Valuable. What if a partner is reluctant to discuss past sexual experiences?
Advice is, first, consider what info you seek and why. If it's about health safety, explaining the desire for mutual responsible choices might encourage openness. Reassure them you'll listen without judgment. Create that safe space.
Setting a non-judgmental tone. What about the awkwardness of being caught being intimate by, say, a parent?
Advice is maintain open communication with both parent and partner. With the parent, try to understand their reaction, deceived, worried. Work to rebuild trust. With the partner, be understanding of their embarrassment. Reassure them you care, they did nothing wrong. Hope to eventually find humor in it.
Delicate balancing act. The book also reflects on technology's impact.
Acknowledges how technology changed access to sexual info, easier access, harder verification. Focus shifts to using tech effectively responsibly for sexual health and relationships.
Social networks are huge now.
Briefly touches on pros cons, leading into advice on responsible online behavior regarding personal life sexuality.
What are the key social media blunders to avoid?
Gives examples. Oversharing health issues, posting provocative and nude pics, loss of privacy, future repercussions, sharing illicit behavior, risks future opportunities, negative posts about exes, unattractive.
Good reminders. Cyberbullying and online safety.
Stresses seeking help if engaging in or experiencing cyberbullying highlights underlying emotional issues, potential harm. Reiterates basic online safety. Cautions against dismissing all advice even if dangers seem rare.
Better safe than sorry online. Body image and selfies.
Acknowledges difficulty taking flattering selfies. Encourages not getting discouraged by imperfect results. Reminds social media is often highly curated, unrealistic.
Keep perspective. Online porn is addressed too.
States high prevalence among young people. Mentions a stat like 90% of 8-16-year-olds. Aims to address it realistically, not moralistically.
What's the key message about it?
One main point. Remember, porn actors are real people with lives, feelings, deserve respect. Discourages negative comments. Also warns crucially about unreliable online sex ed sources like Yahoo Answers or Urban Dictionary.
Misinformation spreads easily.
Yes. Notes how it spreads among friends treated as fact.
Yeah.
Encourages same skepticism for sex info as for obvious online myths. Suggests actively correcting misinformation found online, comments wikis, with links to fact-check sources.
Empowering people to be accurate sources. What about parents invading online privacy?
Acknowledges it feels like a violation. Advises communicating with the parent about respecting privacy, boundaries, while acknowledging their potential safety concerns.
Open communication again. Jealousy about a partner watching porn.
Suggests it's a normal feeling, often stems from wanting to feel most attractive, not competing with idealized portrayals. Advises open, honest talk with the boyfriend about these feelings.
Uses an analogy.
Compares it to using a vibrator, prompting reflection on what counts as cheating. Says if the relationship is valued, a willing partner should listen and be honest.
Dialogue and understanding. Finally, advice on nude photos.
Strongly advises against sending them if uncomfortable. Communicate that preference honestly. Stresses sharing nude photos received from a partner with others is a huge breach of trust and privacy. You can't guarantee others will respect them.
Privacy and respect are paramount there. The book includes a full index, too.
Yes. Lists tons of terms. Vaginal sex, virginity, viruses, vulva, wet dreams, withdrawal method, yeast infection, etc. Shows the breadth of topics covered.
And the contributor, Nicole Hasler, has a strong background in this field.
Yes. Writer, producer, hosted a web series on teen sex ed, led workshops. Lends credibility to the book's information. Her experience makes her a knowledgeable voice.
Well, we have certainly covered a huge amount of ground today, taking a really deep dive into sex, an uncensored introduction. We've explored just a massive range of topics.
Nothing.
From understanding normal bodily functions, changes during puberty, all the way to navigating relationships, intimacy, and the complexities of, well, the online world we live in now.
Yeah.
We touched on everything from the practical stuff like menstruation and erections to the real nuances of consent, pleasure, and crucially safe practices.
Right.
This deep dive was really aimed at providing clear, factual information, hopefully helping everyone listening feel more informed, more confident, maybe more empowered as they navigate these often complex parts of life.
Exactly.
Remember, understanding your own body, your choices. That's absolutely fundamental to having a positive, healthy relationship with your own sexuality and, of course, with others.
Couldn't agree more.
And this conversation, it's really just the beginning, isn't it? It's a lifelong journey of learning. We really encourage you to keep exploring reliable resources and maybe most importantly, to foster that open, honest communication in all your relationships. Partners, friends, trusted adults, don't ever hesitate to ask questions. Seek clarification when you need it.
And that brings us to a really important question, I think, for everyone listening to consider. Given the sheer volume of information and all the different opinions swirling around about sex and sexuality, what single piece of information or maybe insight from our deep dive today do you personally think is the most crucial for everyone to really understand? And maybe thinking further, how might that specific piece of knowledge actually lead to healthier attitudes and behaviors in our society?